Hello everyone. So my name is Dr. Akansha Srivastav. I am MDS in oral pathology. I am senior lecturer in Dr. B.R. Ambedkar Dental College, Patna. So here I am going to discuss a very important topic, that is developmental disturbances of oral and paraoral structure. So this is the first chapter of the shapers. So let's get started. So we are going to discuss over here is what is developmental disorder, what are congenital birth defect, and what are the etiologic or causative reasons behind congenital birth defect. What is craniofacial anomaly? What are the etiologic causes of craniofacial anomaly? And last but not the least is what are the most common types of craniofacial anomaly which we encounter in our day-to-day life. So, developmental disorder is also known as neurodevelopmental disorder. Now, developmental means which is present since developmental time. Disorder means disease. So, it is a diverse group of long-term condition that begins to affect the people in early childhood. Now, why it is called as long-term condition? Because usually all the disorder requires a long-term therapy or treatment in order to get the desired result. Now, these conditions affect the child ability to participate personally, socially, such as social interaction and within the social gathering, academic areas of life, that is in his or her career life. Now, paraoral means structures as present near or adjacent to the mouth. So here we are going to discuss all the developmental disorder and of the oral, that is oral cavity, and the structure which is present near or adjacent to the mouth. Now, congenital birth defect. Congenital birth defect presents a huge socio-economic problem for the affected family and for the government. Now here you can see that the child having the microcephaly means small head. So here the family is also affected and the government is affected by affecting the morbidity and mortality rate. Okay. The initial psychological impact on the parents and immediate family also get affected with the upbringing of the child, putting strains on the financial resources. Now means it took lot more expenses while treating the child having congenital birth defect. So now it is very important to understand the embryological development as well if we need to understand the congenital birth defect, because all the disturbance took place during the birth time, during the developmental time. So here we can see that all the microorganisms, major part of the microorganisms is present in fifth and sixth week of intrauterine life, and this is the most crucial time where teratogen will is going we are going to discuss in our coming slide. Teratogen is going to be affected. Also, we can see here, the since we are more restricted to the oral aspect, so oral aspect of the embryo is progress to a major extent since 10th week. Okay. So what are the etiologic causes of congenital birth defect? First one is vaginal environment, that is vaginosis. Vaginosis, any sort of infection within the mother's vagina, especially the gram-negative bacteria, can cause congenital birth defect. Increase in maternal age. Okay, in the coming slide we will also discuss the percentage of increase in maternal age which can cause congenital birth defect. Workplace hazard. Now ladies, pregnant ladies who had been exposed to various biological hazards, chemical hazard, physical hazard, radiological hazards, and pharmaceutical hazard are more chances of having the baby with congenital birth defect. Now, various exposure to teratogenic drugs or agent. Now, what are teratogenic drugs? Like smoking, drugs like alcohol, various microorganisms or antibiotic. Take a woman who is more exposed to these kind of teratogenic agent have the chances of having a baby with congenital birth defect. Now, lifestyle diseases. Now, if the mother is suffering from diseases, lifestyle diseases such as diabetes, hypertension, also have the chance of having the baby with congenital birth defect. So these are the percentage associated with increased baby with congenital birth defect. Now we can see here that the mother more than age of 39 years have 29% of the risk of having congenital birth defect baby. Now here we will discuss some very important frequently encountered maternal risk factor which can cause congenital facial defects like cleft lip and cleft palate. Okay, so these factors are maternal diabetes, hypertension. Out of these, the most commonest and most prevalent factors are, first one is chronic alcoholism. Chronic alcoholism means the pregnant woman who is taking consuming alcohol for a very long time. 50% of the women is suffering from that and having a baby of such congenital facial defect. After that, folic acid deficiency or vitamin B12 deficiency. 47% of the women are not are taking diet lacking in vitamin B12. Also, so having the baby, chances of having the baby with congenital facial defect. Apart from that, we have maternal diabetes is also carries 11%. Active smoking. Smoking means the mother who is smoking as well. 25% also affected with such congenital facial defect. Passive smoking means the mother who have been herself is not smoking, but she had been exposed within the environment having the smoking environment. It means the person or individual present near to him is smoking, so she also get inhaled. Now, child and adolescents of craniofacial anomaly have various appearance disturbances differences like his facial symmetry is not well. He or she may also gone through the facial asymmetry and various functional differences such as vision problem, speech problem, breathing problem, hearing problem, learning disabilities, which can potentially compromise the child's psychosocial adjustment, means he or she may not be able to adjust normally within the social environment. Okay, so surgical correction is the treatment, and surgical correction will help minimize breathing and feeding problems and other functional differences problem, and it also allows the child to cosmetically look more normal. So, surgical correction is one of the treatment which helps in correcting the appearance differences as well as functional differences. Now, and the child having craniofacial anomaly creates various medical issues, negative social interaction. Why it is negative? Because the other person may make fun of them or something like that. Socially, they may feel very shy. Financially, the financial burden is also increased. Emotionally, they can become very weak. So it all causes the child behavior problem, which like self comparison, and which leads to depression, anxiety, and various other problems, and also put a stress on the affected families. So coming on to the definition, these are the definitions which is present in the shaper. So craniofacial anomaly are the diverse group of deformity in the growth of the head and facial bones. Congenital craniofacial anomaly, a structure functional anomaly that present in infancy or later in life and is caused by event preceding birth, whether acquired or inherited. Acquired means which is acquired from the environment or any kind of certain disorders, and inherited means which is present since birth. Anomaly is a term which means irregularity or different from normal. Congenital is something which is present since birth. Okay, it may congenital may be mild or severe. Mild means very not very severe, and or severe that may require surgery. Malformation is an isolated birth defect which is caused by abnormal growth of the organ, and if surgical correction is possible, it usually have a good prognosis. Means it if the surgical correction has been done, it cosmetically provides a good or desired result. Now, etiology or causative agents of craniofacial anomaly, a combination of genes. Now, if you have read the reproduction process, a child receives a particular combination of genes from both mother and father. So, there may be a change in the genes at the time of conception. Conception means when there is a fusion of sperm and egg, resulting in the craniofacial anomaly. It means if there is a defective gene, it may cause craniofacial anomaly. Environmental. Although there is no data show direct correlation between any specific drug or chemical exposure causing craniofacial anomaly, but it has been found that some of the environmental factor may cause craniofacial anomaly. Folic acid deficiency or vitamin B12 deficiency. Folic acid is present in orange juice, fortified breakfast, cereal, enriched grain product, and green leafy vegetable. Now, women who do not take sufficient folic acid during pregnancy or diet lacking folic acid have the high risk of baby having craniofacial anomaly, especially cleft lip or cleft palate. Now, there are some most common types of craniofacial anomaly which we see. First one is craniosynostosis. Craniosynostosis is the suture of the skull or infant closed too early. Then is desired time. So it causes the problem with the development of normal brain and skull growth or premature fusion of one or more suture of the skull. Okay. Etiology are intrauterine crowding, passage through the birth canal, or and vacuum or forceps assisted delivery. It may cause craniosynostosis. So these are the pic having the craniosynostosis or premature fusion of sutures. Okay. It may be sagittal, metopic related to forehead, coronal. So these are the names of the sutures. Just accordingly, they name them. Lambdoid is also the suture. For example, if there is a premature fusion of the lambdoid suture, then it is known as lambdoid unilateral or bilateral suture. Okay. So it may cause various syndrome, or it may be associated with primary abnormalities as a part of the syndrome or secondary to systemic syndrome. Second one is hemifacial microsomia. Hemifacial microsomia is the condition in which the tissue on one side of the face is underdeveloped, affecting the primarily the ear, mouth, and jaw, mainly mandibular. So here it means that ear, mouth, and jaw is underdeveloped. It is also known as Goldner syndrome, branchial arch syndrome, facio-auriculovertebral FAB syndrome, oculo-articulovertebral spectrum, lateral facial dysplasia. So these are the another name of hemifacial microsomia. Third one is hemangioma. Hemangioma is a birthmark. It is a benign non-cancer tumor of the skin. It is present as faint red mark, as you can see over here, and appears in the first month after the birth. It is also known as port wine stain, strawberry hemangioma, and salmon patch. Another one is deformational or positional plagiocephaly. It is an asymmetric shape of the head or cranium. Okay, so it has also called as oblique head. Preview means oblique and cephalo means head. So these are all. That's it. I hope you have understood the chapter. In case of any query, feel free to ask. And don't forget to subscribe and like my channel. Thank you very much.